The former Secretary of State for Health, Stephen Dorell, joins us now. Hello, nice to see you again, Stephen. Our representative from Unison said no one wants to see care homes forced to close because they don't have the staff. It's a fair point, isn't it? But isn't that the possible outcome of this mandatory double-jabbed policy in care homes?
Yes, I think it is. There's a very serious risk that will happen. And I think Sajid Javid actually missed an opportunity in the statement he just made to the House of Commons, because he knows very well that there is resistance to compulsory jabs in the social care world. And it's interesting, isn't it, that ministers are actually, there's a piece of legislation in front of the House of Commons at the moment making provision for integrated care, joining up the health and care system, recognising that a nurse working in social care is just as much delivering nursing care as the nurse working in the National Health Service. But as of Friday morning, the nurse working in social care will lose her job, his or her job, if she hasn't had a jab, whereas in the health service, that rule doesn't apply till next April. I would have thought it was an opportunity for Sajid Javid to demonstrate that he recognises these two systems are in effect the same, and at the very least to align the dates on which this the law changes. I think before we go down the route of compulsory vaccination, we do have to work out how we're going to ensure that the health and care system, all 3 million people who work in it, are going to be properly staffed the day after.
Stephen, a lot of people will be scratching their head, people who support NHS workers having the jab for common sense reasons, if you like. Why wait until April? It's almost 6 months away. I mean, yes, it will take time. You don't want to introduce it as of tomorrow, but 6 months?
But yes, it's 6 months for NHS staff. I'm sorry to make the point again, but I do think this is a very real point. I heard Gloria say earlier that the point that's been made repeatedly in the last few weeks, that nurses and other care staff working in the care system have been thinking about, and in some cases probably doing, moving from the care system to the NHS. But that remains a real issue, it seems to me, during this winter, if there's going to be a different rule applying to care staff working in social care from those working in the NHS. Now, my own strong preference is for persuasion and for demonstrating the benefits to the patients of the health service and the users of social care, asking people to consider it from their perspective. That seems to me to be the key argument. And it's an argument that is to some degree undermined by making it the jabs compulsory. It's a great mistake for ministers, for governments, to believe that if you pass a law, you don't have to persuade people. Well, that's wrong. You do have to persuade people. And in this case, I think they do well to place more emphasis on persuasion and argument and less on the force of law.
Government estimates suggest 40,000 care workers could leave the profession. There are already 100,000 vacancies in social care. That's a crisis. What do you do to solve it?
Well, you don't ban people from working in social care who want to be in the care home or in the home care activity on Friday morning. What you do, let me be crystal clear, I'm wholly in favour, unambiguously 100% in favour of care staff, whether in the social care sector or in the National Health Service. I'm in favour of those people taking COVID jabs, being vaccinated. I'm strongly in favour of it. But I think the way you maximise that effect is by persuasion. And also, of course, those responsible for delivering these services, for the management of those services, if there are members of staff who are not vaccinated, there's a huge issue about whether those members of staff should be put in a position where they might put patients or service users at risk. So the value of somebody without a vaccination is significantly less than the value of somebody who is vaccinated.
The instincts of all of us, Stephen, is to use persuasion rather than coercion. But in the end, what do you do if people aren't getting the jab and they're putting vulnerable elderly patients at risk? Will persuasion extend to money, do you think? Is that where this will end up?
No, I'm not in favour of that. I said earlier, I think Sajid Javid missed a trick today, actually, which is to give himself more time to undertake full persuasion. Gloria said, why wait till April? Well, why not use the time, both in social care and in the health service, to justify, to make the case, to argue, to persuade people that actually it's to the benefit of patients and service users, for the staff who are caring for them, to be vaccinated, and align the dates on which a nurse working in one system has the same obligations as a nurse working in the other system.